My name is Aman Shukla, and I am based in Delhi, India. I lead a youth-led network called as YOUNITE Global. It's a global youth platform for young people to advocate for their rights, do awareness, advocacy on TB response, bringing youth leadership in the TB response, which was missing. And we know that TB is not yesterday's disease. It's a 100-year-old disease. And here you can see some of the pictures of young people's action in the ground. You will see some of the interventions, advocacy awareness among adolescents in school, young peoples in skilling centers, orphanage children's living with HIV in Manipur, hard to reach area. And these are some of the work that we do at the grassroots level. Of course, this everything is entirely voluntary, but this is all driven out of our passion and dedication to NTB. My subject for this presentation is youth-led innovation and success stories on drug-resistant TB treatment rollout. So whenever we do the awareness sessions and any work related to the TB, we make sure that we include drug-resistant TB information for the young people and adolescents to understand, so that they have a good treatment literacy about the drug-resistant TB like BPAL, stuff. So I don't have any conflict of interest at this moment, but maybe would like to have more conflict in the future. So, for the global context, we all know that WHO published a global TB report, and it gives a very good kind of a vibe and very bad kind of a vibe. Why? Because they say that it's a progress in TB response. I don't think so. It's a progress in the TB response, because still we see that there are 10.7 million people fell ill with TB, and it was the same scenario in 2023. There are people dying of TB, 1.23 in 2024, and in 2023 we all know it was 1.3, and I don't think so that is a progress. And we still need a lot of work to be done, and for that we need each and every stakeholder on the table to work for this. So youth innovation from awareness to action. UNITE has been doing some of the work in India. We have a country chapter in India and a dedicated team of people who voluntarily work in different states of part in India, where the burden of TB and DRTB is very high. UNITE engages youth to strengthen TB awareness and literacy, especially on new regimen like BPALM, because having a good treatment literacy will improve your outcome of the better outcome of the treatment. And also when you're facing with any other side effects, you will be able to kind of cope up with that. And that is the reason we need to have a good treatment literacy. We know then we will be able to cope up. We will be able to also educate our other fellow members about the treatment. Collaboration with the universities, Indian medical associations, NSS means in India we have a wing of National Social Service, or we say National Social Scheme, where there is a young people's network that talks about and work on social work. And that is how we thought of engaging them and educating them about TB. And youth institution across India, we promote treatment literacy, we promote peer advocacy and informed health decision. It's just not important that people, those who are converted, should know about TB. It is important to educate and promote about TB's work, people those who are not affected by TB, because I understand that TB anywhere is TB everywhere. And we think that if this kind of activity promotes the ripple effect, and youth taking a leadership role and spreading awareness in their communities brings an impact. And that impact brings not only in India but globally. As we all know that in India we have 25% of global TB burden. And if we do something in India, and it gives an impact globally. Till now, we have engaged 2,500 plus students actively through our campus event webinar when we started this work in 2024 till date. So this is a number that a very small number as per our country's burden and population, but we are trying to do much more things with the TB Alliance, Fast Track the Cure, and many like you all, to bring impact among young people. What are those digital innovation and social media work that we have done? As as a youth TB movement. We do a digital storytelling on Instagram. We do it. We talk about myth and facts on our Instagram through podcast, through Instagram lives, and we also bring people those who have finished their BPAL M regimen and talk about their experiences. And we also bring people those who have not got the chance to have the BPAL M and talk it gives a good information about them, what was the situation earlier and what is the situation now for the people who don't know about the TB history. And then we do the webinar connecting experts and young TB survivors and DRTB survivors to discuss new treatment updates. What are the difficulties that they faced, and they don't want to be seen that same thing with their other fellow people. So we discussed that as well. And this is a result where we saw that 20,000 plus social media engagement on youth-led TB contents in just 2025. We saw that on Instagram, Facebook, and on our LinkedIn. Youth followers from 15 plus Indian states fostering inclusive TB dialogues online. Now we have India is a vast country, diverse language, diverse culture, diverse people, and they have diverse kind of way of acting. We have coped up with that mechanism and thought of having a state ambassadors, and now we have 11 ambassadors across India to act on this voluntarily and support this cause to end TB. Innovation in health literacy. What else we did? We developed a brochure called as Nourish to Flourish. It's a community-led brochure that talks about the information about nutrition in TB response. In collaboration with Stop TB Partnership and TB People Global, we developed this brochure to promote balanced diet guidance, mental health care, and treatment adherence tips for young people who are undergoing DRTB treatment and other TB treatments. And we have Temi here, who has also the part of this development of the Nourish to Flourish document, and she was the part who also shared the best examples from the Brazil. And we emphasize that WHO also emphasized that undernutrition is one of the strongest TB risk factor globally, and we all know that, but still we lack on working on that. And that is how we as young people thought of having a brochure and disseminating that at the country and grassroots level about the importance of TB, nutrition into the TB response, and advocating for having nutrition integrated TB response in all the country. And that is how we developed this and circulated among youth-led CPOs and then global networks to adapt this document and take it forward. Youth engagement in achieving end TB goal. We know that global target as per UNHLM 2023, we want to see that 100% coverage of rapid TB diagnostic testing and 90% treatment coverage by 2027. But the gap of the funding is still persist, everywhere, and we are not able to cope up with that. That is the reason we all need something which is voluntarily and needs less resources to amplify and do something about TB. Promoting treatment literacy and on BPAL M rollout, creating digital accountability through youth-led monitoring, mobilizing youth voices for domestic health financing, and political and financial commitment at the country level. So these are some of the work that we have done as a young people, as an innovation in the country. So thank you with this. I'm at the end of my presentation, but I just want to finish this with one sentence, Akshay, I'm so sorry. Every young person leading change against TB is rewriting a story. From stigma to strength, from patient to leaders. So please invest in young people. Thank you so much.